then I got one here. Fulton County Farm Bureau has been made aware of proposed pipeline to be constructed throughout the area. They came and talked to Patrick and I, don't know if anybody else was there or not, a while back, and we're going to build some kind of pipeline, and it's going to come down. It's going to end in Decatur, I think is where it's going to end, somewhere down that way. So I don't remember when they said construction would even start on. I thought they said like next year, or well, this year now, late sometime.
I read that also. They're going to inject CO2 deep in the earth. What is this from?
It's from petroleum, I think. It's something comes off.
But I mean, it's
petroleum.
not Illinois. It's just they're shipping that CO2 down.
Yeah.
Through a pipeline.
Yeah. Comes from way up north somewhere.
They're going to inject it.
I don't remember it started in Minnesota or someplace. So a while back when they came talk to us, they showed us the map and stuff. Kind of potentially how it was going to go. They didn't know for sure. Okay. Proclamations, we have a few. Patrick, you want to start with the first one?
Yeah. This is our monthly proclamation of a disaster in Fulton County. Whereas the proclamation of a disaster in Fulton County was implemented on March 19, 2020 due to the COVID-19 pandemic, and whereas that disaster proclamation was effective through November 29, 2021, and whereas the Fulton County Board authorizes an extension of the disaster proclamation through February 8, 2022, therefore be it resolved that the Fulton County Board Chairman approve this recommendation. Be it further resolved that the county clerk notifies the county board office and all Fulton County department heads and Fulton County elected officials. Be it further resolved that this proclamation will be extended until the aforementioned date or until the governor of the state of Illinois rescinds or allows his executive orders to expire.
Get a motion to approve that. Motion by Barry, second by Mr. Maxson.
Barry Stan?
Dan Barry. Okay.
Yeah, you gotta be Pacific.
Okay. Any discussion? Roll call, please.
Spengler,
Yes.
Thompson,
Yes.
Williams,
Yes.
Wilner,
yes,
Arnett,
Yes.
Beck,
Yes.
Barry,
Yes.
Bowler,
Yes.
Clark,
Yes.
Duchesne,
Yes.
Duquesne, Duquesne,
Yes.
Hoke, Kessel,
Yes.
Coomer,
Yes.
Madsen,
Yes.
Meadus,
yes,
and Platt.
Yes.
Motion carried.
Okay. Next one. Ken Fuller.
Okay. Whereas the Village of Banner is a unit of local government located in the county of Fulton, state of Illinois. Whereas Kenneth Fuller was appointed village president of Banner, Illinois, approximately 28 years ago and subsequently elected thereafter. Whereas Kenneth Fuller has honorably served the residents of Banner, Illinois as their village president for 28 years. Whereas under Kenneth's leadership, multiple public works projects, including but not limited to a berm constructed around the village's sewer plant to protect against flooding, grants acquired to help reline all the sewer lines, and a large holding pond and upgraded equipment was obtained for the sewer plant. Whereas on November 9th, 2021, Kenneth Fuller resigned as Banner Village President after 28 years of service, although he will stay and serve as a village trustee. Now, therefore, be it resolved by the Fulton County Board that they formally recognize the accomplishments and dedication of Kenneth Fuller in his more than 28 years of service to the Village of Banner and Fulton County.
Get a motion. Motion by Coomer. Second by Arnett. Any discussion? Roll call, please.
Thompson,
Yes.
Williams,
Yes.
Wilner,
yes,
Arnett,
Yes.
Beck,
Yes.
Barry,
Yes.
Bowler,
Yes.
Clark,
Yes.
Duchesne,
Yes.
Duquesne,
Yes.
Hope,
yes,
Kessel,
Yes.
Coomer,
Yes.
Manson,
Yes.
Meadus,
Yes.
Platt,
Yes.
Spangler.
Yes.
Motion carries.
All right, thank you. Next one, Brenda Ford.
Whereas Brenda Ford, longtime employee of the Clayburgh Fulton County Nursing and Rehabilitation Center, retired on January 25th, 2021. And whereas Brenda Ford has faithfully served the residents of Fulton County for the past 22 years. And whereas it is appropriate to recognize Brenda Ford for her many years of service to Fulton County. Now therefore be it resolved by the Fulton County Board that this board go on record in recognition of the work of Brenda Ford during her many years as a valued employee of the Clayburgh Fulton County Nursing and Rehabilitation Center. And be it further resolved that this resolution be recorded in the permanent files of the Fulton County Board.
May I get a motion to approve it? Motion by Mattson, second by Arnett. Discussion? Roll call.
All right. Williams,
Yes.
Wilner,
yes,
Arnett,
Yes.
Beck,
Yes.
Barry,
Yes.
Bowler,
Yes.
Clark,
Yes.
Duchesne,
Yes.
Duquesne,
Yes.
Hope,
yes,
Kessel,
Yes.
Coomer,
Yes.
Manson,
Yes.
Meadus,
Yes.
Platt,
Yes.
Spangler,
Yes.
and Thompson.
Yes.
Motion carries.
Thank you. All right, excellent. Carol Taggart.
Whereas Carol Haggerty, longtime employee of the Clayburgh Fulton County Nursing and Rehabilitation Center, will retire on March 1st, 2022. And whereas Carol Haggerty has faithfully served the residents of Fulton County for the past 22 years. And whereas it is appropriate to recognize Carol Haggerty for her many years of service to Fulton County. Now therefore be it resolved by the Fulton County Board that this board go on record in recognition of the work of Carol Haggerty during her many years as a valued employee of the Clayburgh Fulton County Nursing and Rehabilitation Center. And be it further resolved that this resolution be recorded in the permanent files of the Fulton County Board.
Okay, I need a motion.
I'll make a motion to
Motion
approve.
by Duquesne, second by Coomer. Any discussion? Roll call.
Wilner,
yes,
Arnett,
Yes.
Beck,
Yes.
Barry,
Yes.
Bowler,
Yes.
Clark,
Yes.
Duchesne,
Yes.
Duquesne,
Yes.
Hope,
yes,
Kessel,
Yes.
Coomer,
Yes.
Madsen,
Yes.
Meadus,
Yes.
Platt,
Yes.
Spangler,
Yes.
Thompson,
Yes.
and Williams.
Yes.
Motion carried.
Okay. Next one.
Next one. Whereas Sheila Schisler, longtime employee of the Clayburgh Fulton County Nursing and Rehabilitation Center, will retire on January 29th, 2022. And whereas Sheila Schisler has faithfully served the residents of Fulton County for the past 20 years, and whereas it is appropriate to recognize Sheila Schisler for her many years of service to Fulton County. Now therefore be it resolved by the Fulton County Board that this board go on record in recognition of the work of Sheila Schisler during her many years as a valued employee of the Clayburgh Fulton County Nursing and Rehabilitation Center. And be it further resolved that this resolution be recorded in the permanent files of the Fulton County Board.
Okay, motion. Motion by Beck. Okay. Second. Arnett.
Okay.
Roll call.
Arnett,
Yes.
Beck,
Yes.
Barry,
Yes.
Bowler,
Yes.
Clark,
Yes.
Duchesne,
Yes.
Duquesne,
Yes.
Hoke,
Yes.
Kessel,
Yes.
Coomer,
Yes.
Mattson,
Yes.
Metis,
Yes.
Platt,
Yes.
Spangler,
Yes.
Thompson,
Yes.
Williams,
Yes.
and Wilner.
Yes.
Motion carried.
Okay, thank you. All right, public remarks. Consent agenda. Motion to approve it. Motion by Thompson, second by Bowler. Any discussion? Roll call.
Beck,
Yes.
Barry,
Yes.
Bowler,
Yes.
Clark,
Yes.
Duchesne,
Yes.
Duquesne,
Yes.
Hoke,
Yes.
Kessel,
Yes.
Coomer,
Yes.
Mattson,
Yes.
Metis,
Yes.
Platt,
Yes.
Spangler,
Yes.
Thompson,
Yes.
Williams,
Yes.
and Wilner. Sorry,
Yes.
Wilner and Arnett.
Yes.
I didn't forget you.
Okay, moving on to the action agenda. Treasurer's report.
You want a mic?
That's all. Thank you.
These guys paid for this broadcast
Setting
here.
me up for disaster, O'Brien. Good evening, everyone. Going to start off with what the first month of our fiscal year looks like for County General. There was a revenue total of $858,630.99. Expenditures totaled $695,758.15. That provided a surplus of $162,872.84. Unfortunately, or fortunately, however you want to look at it, our insurance company did not generate an invoice for our health insurance. That's around $200,000 of an expenditure. So this number for December does not reflect an insurance payment. We are not late. There's no reason to worry. Clerk O'Brien and I, it's all being taken care of, but I just wanted to let you know that the numbers for December and January will be a little bit skewed because of that. Because more than likely there'll be a double payment for insurance for this month. So still, it's nice to say there is a surplus for the month of December in County Gen. All of the other funds are reported, whether it's your income statement or on the balance sheet. Does anyone have any questions on the financials that you received? Yes.
I'd just like to comment that I really love the new sheets for the funds.
Thank you. This one,
Yeah,
the
so much
balance
better.
sheet. I know my chief deputy, I tasked her to changing it. She made it look pretty. She's a rock star. Thank you very much. I will pass that on and she will be excited to hear that you like it. So thank you very much. Secondly, our audit has begun. There are four auditors probably getting ready to leave the building. Our audit will take place all week. Thank you very much to the departments that have been doing their due diligence and gathering up what the auditors need. They're rapid firing, lots of questions, lots of reports, lots of documentation. It's a really, really, really fun week for Fulton County right now. Along with our overall county audit, there is also going on the OPEB audit, which is other post-employment benefits audit. That is one that is done as an actuarial basis, not an accrued or a cash basis. There's a lot of data, a lot of information, and we hire out a separate firm to do that. So my office and I are generating all of the requested information. Once we get done with our side of it, I'll pass it over to the clerk side. They'll do their part of it. I'll combine everything together. And then the true fund will begin on that audit. The work comp audit, in terms of all the numbers, will begin probably in the next month or so. give us just a little bit of a break from audit stuff. And lastly, W-2s. My payroll clerk and I are working together on starting the balancing and the proofing. We have, I believe, 300 or 304 W-2s this year. So obviously, we have to have them out by the end of the month and the W-3 filed, but we're working really hard to try to get those out to the employees as soon as possible. But bear in mind, there's a lot going on in the office right now. Any questions, thoughts, concerns, besides an awesome balance sheet? Okay, thank you very much.
Thank you. Okay, health. Laura.
I know. I'm aware. 10 degrees hotter up there.
10 degrees hotter.
Good evening, everyone. I'll start with the Clayburgh. We do have 1 resident and 4 staff that are COVID positive right now, but things seem to be under control for the time being. So let's hope that we don't have any more and they get better and we're all good. Clayburgh did have their annual IDPH survey last week, and we were found deficiency free, so that is great news. As far as the health department and COVID related, the county has a 9.74% test positivity rate right now. We have 611 current active cases in the county. We've had more than 100 deaths in the county to date. About 55% of the county are fully vaccinated, and 44% of those who are fully vaccinated have also been boosted. If you take a look at the IDPH Region 2, which is what Fulton County is part of, 6% of ICU beds are available, which equates to 15 beds. So COVID or not, if you have a car accident or a stroke or anything like that, your likelihood of getting an ICU bed is not great right now. So keep that in mind. If you can look online at anything and look at the large health systems that post this, the vast majority of people who are being hospitalized right now and are in the ICU are unvaccinated. So as always, I would encourage you to consider it if you haven't yet and get boosted if you haven't. There are a lot of breakthrough cases happening even for those who are vaccinated and boosted, but the likelihood of getting sick is much less, I think, than if you weren't vaccinated at all. Questions?
Okay, thanks, Laura. Highway, Nestor.
Well, not too much to report this month. The guy's been pretty busy doing the snow removal and fighting the wind. I think they did an outstanding job for what happened to them all of a sudden with the snow and turning the ice. So I'd like to give the guys a round of applause for that, man. They kept us. That's all I got to talk about tonight. Thank you.
Okay, any questions for Nestor? Okay. Public safety and campground. Mary? Oh, there she is. Sorry.
Mary, you may
I
be
know I heard
seated
her
as a
name.
member of the body.
Okay.
I got it. You need a mic?
Yeah, mine.
Yeah.
Yeah, better.
Stay in front of the camera, too.
Oh, no. No way I'm hiding. No, we passed the contract for the city of Cuba for the county deputy to patrol. And we just got past all the claims. And then sheriff had some extra radios. He's gonna leave it for Chris to donate it to whomever needs it. And that's about it, isn't it? Yep. Any questions?
Anybody got questions for Mary? All right, thanks.
Oh, thank you.
Sorry.
Thank you very much.
Oh, thank you.
Okay, property and courts. Cindy?
We've basically started a discussion of working on the courthouse pillars. This is kind of a long term, nothing's gonna be done immediately at all. The last estimate on that was over 200,000, we know it's gonna be more. Bill Schmidt commented we needed to get somebody in to do a yearly contract of checking the courthouse roof and monitoring it. So we're gonna get on that. And the estimate for the replacing the last air conditioning unit, Patrick just sent this to me, is $36,255. We're looking into making sure that it's taken care of this year too. Lisa had sent me a message about the lights. Bill had commented as he met with Roger and I that he was expecting a box in December. Did he get that box and get them?
That he's been putting some in.
Okay, so, all right. Anybody have any questions for me? All righty,
Okay.
thank you.
All right, P&L. Ms. Cox.
Mr. O'Brien, may I have your microphone?
Yes, Mrs. Thompson, you may.
Thank you very much. Okay, tonight we have a very important topic on our agenda for action, and that is amended COVID policy. We had a COVID policy in place, but when OSHA came out with the vaccine mandate, we took our old policy and put it under workplace safety within this current policy that you're looking at tonight. So, the policy follows the federal mandate for vaccine or test. The version that was in your board packet tonight was the working copy. So you see all the corrections that were being made, and they were all made within the final document. I believe that was emailed out yesterday. But I do want to tell you that there were 3 changes that you should know about. One of them is on page 1, under covered employees. It says all employees of the county. Now, Circuit Clerk has brought it to our attention that they need to be accepted from that because they follow the guidelines for the Ninth Judicial Circuit. So we will have to amend it for those purposes. Also on page 2, at the top of the page, there is a mandatory vaccine section. It differentiates from all employees. It says that the health department will follow the policy for the Board of Health, and that the employees of Clayburgh of Fulton County Nursing are subject to mandatory vaccination requirements per the interim final rule of the Centers for Medicare and Medicaid Services. So that was added. And then the last change that was made was on page 9. And that is under section 4.11 face coverings. It says originally it was Fulton County. It said Fulton County will require all employees who are not fully vaccinated to wear a face covering. But there was the sentence above that that says that Fulton County still encourages everyone to wear a face covering. But if you're not vaccinated, you have to wear one. So, with all that said, there were some questions at committee that I'd like to clarify, and that is, basically, we have to either vaccinate or test. The plan has been, and I'm going to explain this. It's not really clearly defined. I mean, we seriously are flying by the seat of our pants here, trying to figure out what to do to mitigate COVID-19. So, when it refers to testing in here, we're going to be doing rapid tests. We're not sending everybody to the hospitals and Walgreens to get a PCR test. We've got rapid antigen test on site that will be available for the departments. The departments still have to report that all employees test negative though. Now, Laura, I don't know, maybe you can help me, but I mean, the healthcare's been doing these rapid tests for months on end, have they not? And they just, everybody just does a rapid test, it is negative, and they go on about their workday, correct?
I'm not a testing expert by any means, but I think sometimes when there is a positive rapid test, they do send them on to have like the full
Have the
lab,
PCR, yes, and that is recommended, yes.
but otherwise I don't.
So, all right, I think that's all I want to say for the moment, so, oh, no, I'll say one more thing. And that is Illinois OSHA today approved the vaccine mandate for Illinois. And those dates actually extend some of these requirements in here a little bit. So we do have a little bit of time if we need to work on it, but I think the sooner we do something, the safer our workplace is. That said, I'll make a motion to approve the policy pending an amendment for the circuit clerk.
Paul? Second?
Right. Duquesne? Okay. Any discussion?
I have some feedback.
Okay. Laura?
Sorry.
Got my pen.
Yeah, I'm ready.
On the section 4.4 on page 5 about supporting COVID-19 vaccination, I just wonder if it would hurt to put a sentence saying something like Fulton County employees are encouraged to get their vaccine at the Fulton County Health Department. Not to say it's required, but those clinics are generally every Friday and they can get online and book their appointment. That just thought it might be something worth considering. On page 7, 8, 9, and 10, we refer to having a doctor's note or a licensed medical provider saying that employees can return to work. I'm not saying that you wouldn't ever get a doctor's note to return to work. If you were in the hospital or something, you probably would, but generally the health department releases you back to work, not the doctor's office. And the doctor's office.
Piggyback onto that.
Huh?
May I kind of piggyback onto that?
Yeah, go ahead.
So we were on a COVID task force call. Right now, they're in the IDPH is in the middle of a transition into what's called surge centers, and so the health departments are going away from the notification, and it's going to go to these surge centers. The facts are that these surge centers don't have the capacity to handle these letters. That's just the facts. So the recommendation is that employers keep track of when their employees become exposed and or contract COVID and count the number of days until they're back to work. This isn't ideal. This should not even be happening, but this is the reality of what's going on out there. If you're in a school setting, the schools are now in charge of contact tracing. The health departments and the IDPH are not going to do that for them anymore. So I just wanted to get that out there. So to support what Laura's saying, you're probably not going to get a physician's note, and you're probably not going to get a letter from IDPH. So it's going to have to be your due back per CDC guidelines would have to be the amendment.
IDPH guidelines. Yeah. Okay, so
Why not CDC?
IDPH is they oversee what we do in the state, so I would think as a
Yeah, but they're
county
not.
government, we have to follow what the state policies are. What do you think?
IDPH adopts CDC policy.
I don't know, it just seems like IDPH is the problem.
Well, they still have their guidelines. They may not be doing what we want them to, but they still have the guidelines that they recommend being posted
From the CDC.
from the CDC.
So.
Yeah. I-
6 of one, half a dozen
I
of the
will
other.
say, it seems like they're changing the days and how many, how long people have to be out and stuff so often. It's gonna be hard for just
Yeah.
Patrick to keep track of what the current,
Yeah, we just keep our fingers crossed.
Okay, but, okay, I think that on page 7, the doctors know prior to return, it's just setting out that we reserve the right, should somebody be extended ill.
I'm just making recommendations, I'm not saying,
Okay, so where was the next one?
if somebody's.
So what gets, what gets our employees back to work?
IDPH guidelines. Yes, you meet the IDPH guidelines. It doesn't say that you have to have a letter from the health department or anyone
And the
else.
county agrees to what those are. They can't just come back and go, well,
Right, so if somebody comes in, they test positive, then, you start counting the days from that day. And then of course, it's recommended that they go get a PCR test once they.
Because I mean, you have IDPH guidelines out there. They adopted what the CDC recommended, the 5-day isolation quarantine rule.
Right.
You still have schools doing 10 days. And IDPH is fine with that too.
and people are still testing positive even after they're out of quarantine.
Yeah.
So it's not like you get a negative test and you get to return to work because they may test positive for longer.
Okay.
Okay.
You just learn something new every day. I literally
I
learned
know,
this
it's-
yesterday.
It is, it's a very fluid situation.
Okay, hang on, Susan,
I have a question now. IDPH has changed their recommendations for isolation or quarantining 2 times. So we'll have to have something in this that says, like Lisa said, that follows the IDPH or CDC guidelines.
See, that's why there's not a day. I don't see anywhere where it says how many days you're out.
It's not written in here because it's changing so
That's what
often.
I'm
We would
saying,
have to change this like every other day in order to
That's
keep
why I'm
up.
saying, if we have something out that says that we follow those 2 guidelines.
Yes, it does. It
Then
just
it
says-
covers whatever the change would be there. But that still kind of leaves a question is, if you're sick, how are you gonna verify how long you're supposed to be off?
Check with your department head.
Well,
I
you
mean,
got-
who's gonna make that decision?
You got 7 days.
As of
7 days. Hang on, one question.
okay, go ahead.
Yes, Susan. The IDPH guidelines lay out how many days you should be off, if you're symptom-free, is wear a mask for like 10 days. I can't quote what they are.
No, I'm just saying, but
However-
if I was an employee of the county and I got sick and I tested positive and I'm vaccinated, I'm gonna be off whatever the current recommendation is, 5 days or 10 days or whatever, then I
Whatever
have,
the current recommendation
okay,
is.
but I can't just come back, I gotta have another test, right?
Yes,
No?
okay, yes. The IDPH is currently
If
tested.
you test positive, you have to have a negative test for you.
Yeah, 7 days.
According to this.
That's what I'm confused
People are
about,
testing
is there's
positive.
just been so many changes.
People are testing positive long after they're out of quarantine.
Oh, yeah, and once you had it, you don't have to test. Per the policy, once you've had it, you don't have to test for 90 days because you can still test positive.
It's
No,
contradictory.
so I guess I want clarification on the return to work thing, because on this, I don't, because I'm not planning on working and I'm not planning on getting COVID. But I do want clarification for the employees.
We're gonna do our best to follow the IDPH guidelines.
Okay.
And the supervisor will just have to work with the employee. Obviously, if they're still sick after 5 days, we sure don't want them coming
Well, I
back.
wouldn't think so, but I have worked unfortunately for bosses who are, they don't care if you're, as long as you're breathing, and you can at least shake one foot, they want you at work. They don't care if you're sick or not. So there's gonna be instances like that.
Okay, Danny?
I just wanted to ask a couple questions there, had a couple comments. If you mandate vaccinations to the employees, who's going to enforce that?
We are not mandating vaccines. We are requiring vaccination status of our employees. If our employees are vaccinated, they will not be required to test. If they are unvaccinated, they will be required to test. It is not a mandate for vaccine. It's vaccinate
I
or test.
understand that, but I'm also asking the question, who's going to enforce that? I mean, if this was to pass right now, in this county is going to say, that employee, you have to be vaccinated or you have to test, and they refuse? Then what?
Well, it says in here that they can be disciplined. Let's hope this,
Because what I see happening here,
you see what?
what I see happening here is going against probably some sort of contract with the union. For one. For two, I see major lawsuits coming out of something like that if someone wanted to spend the money to push it. And three, with the IADPH and the CDC and everybody changing things every other day, I don't see how you can have a standing policy legit for a county with them changing as much as been changed recently. I mean, if I'm a
Do you recommend we do nothing?
no, you have a health department, you encourage people to get vaccinated. That's what we've been doing.
But they don't get back, all we're trying to do is follow IDPH and CDC's
Well, I'm
guidelines.
just
Whatever they
looking
want us
down
to
the
do.
road.
Danny, there's lawsuits happening. It's not, we're not, there's
Yeah,
lawsuits.
and there's all kinds of
Because
lawsuits on
I
vaccination.
tell you right now, and I'm not speaking for any specific employees, I don't see many employees jumping on the bandwagon if they're not vaccinated just to do it for whatever the reasons are, whether it's medical conditions, religious beliefs, legal beliefs, I don't know. But I'm just telling you right now, I think, and I appreciate your work done on this, personnel committee put a lot of time into it, I understand that. I see it's going nowhere with it if we try to pass it, because it's gonna change somewhere in the guidelines again. Then we're gonna have to go back and re-amend it and keep re-amending it.
Not if we have it in there that we just follow their guidelines.
Yeah, that's what I had
Well,
said earlier.
yeah, if you continue to follow their guidelines.
Because they
You
change
might-
so much, we just
I
have to have
guess what I'm
something.
saying is you might as well say, whatever the state recommends or requires, that's what we're going by.
That's in there.
So why would, I guess I have a problem with wasting time and paper when there's other problems.
We have to adopt this. We can't just
We have to have a policy.
ignore
We
it.
have.
say that everybody's gonna follow the guidelines. We have to have a policy in place that we do follow the guidelines.
Well, I mean, can't you just put down on paper you're following the state guidelines?
That's
Yeah.
basically what you're holding in your hand,
And-
but there's a million questions with that for employees.
Well, I mean,
How they'll do it, who's gonna pay for it?
I understand that.
I
But
think-
I mean, how many employees are actually gonna say, hey, you know, if I got COVID, for example, and I come back to work, I'm not gonna reveal my HIPAA information about why I was out for 14 days or 18 days, whatever it may be.
Why? You have to,
But
if
you
you're gonna be
will,
off
and you
work, you
want
gotta
to
give us
work.
a reason you're off work.
Before COVID,
I know what you're saying, but it's gonna have, we're have to make a decision on it, because it's not going away. And you've got county employees.
Well, and I'll say this, I know cases recently where people have called the health department to get on the list for vaccinations and never got a call or appointment back,
Yeah, I don't,
several times.
yeah, I agree with you, but that has got to do with
And
our
I tell
policy.
you what, one of them was my mom, she called up there 10 times the last 2 weeks, and they keep telling her, call back. And they can't give her an answer.
Okay, I will, Danny, I will agree with you that me and my wife tried to call and
Well, I'm not
get a
against
vaccination. We couldn't
giving
keep it through.
vaccinations at
We
all.
told Mason City and we down there in 2 days, had a vaccine, was done.
Yeah.
So,
Yeah.
you know, if you're not getting satisfaction here, call somebody else.
I understand that.
And I've provided that feedback, and I always provide that feedback when I hear it, and I've already provided it tonight, just so you know.
So,
I know,
Okay.
I know out of 33 employees where we're at, only 3 don't have it. They're not vaccinated. The other 30 are vaccinated.
I mean, all we're saying
Boosted and everything.
is you give us a vaccination card, we put it on file, it's in a locked file. And so you report to work, all we have to do is look, eventually we'll know who, but look and see if they have a vaccination card on file. If they do, they come on in, no problem. If they don't, they have to get tested. Even ones that have a card, if you don't want to give us a card, that's fine too, you'll just have to test.
They've slowly been wearing them out. They've been having to have the shot, but they're slowly wearing them out, going over to Peoria to get tested. Everybody's getting tired, everybody got tired of it.
All right,
Every week.
is there, anybody else got any questions?
I just have 2 more things, Roger, on my list. So on the face covering section, should we put something in there about when IDPH advises that face covering should be worn? It doesn't matter if you're vaccinated or not. I mean, where I work, you have to wear a face covering whether you're vaccinated or not, it doesn't matter. So I don't know if we should put something in there again based on IDPH guidance.
Does IDPH state that everyone should wear one?
Right now, I think the recommendation
Is everyone should
I
wear
think
it?
so. I mean, maybe verified, but if we just say it's based on what their recommendation is, and then we can.
Yeah, that covers it.
That covers it.
I say it's at
Okay.
restrooms.
Hang on, Justin, have you got any comments on any of this?
My only comment is,
There he is.
IDPH guidance is just that, it's guidance. We don't have to follow it unless, they put a mandate in, like what they have, which basically this policy is their mandate. Their mandate was they adopted OSHA standards. Primarily, this public rule that just went into effect Friday by IDPH was because they think the federal mandate may fail. So they basically adopted the federal mandate on the state level. And this policy is based off the federal standard. It's a federal, for the most part, we've tailored it to some extent to our needs, obviously, but it's an OSHA form that was put out by the federal government, and the state Friday adopted the federal rule because they thought it could fail when the Supreme Court rules. So the form that we've used and the form that we have put forward in front of you tonight is a form that was made by them. So it goes into effect January 24th. My recommendation is that we adopt it because it's their form. And if we want to amend it or change it before January 24th, we could always have a special meeting and do that. But we need to have something in place by January 24th. And I personally think that what we put together is as good of an attempt at following their guidelines as possible, primarily because most of it's based off their form. And we have to have it done by January 24th. That's when it goes into effect. The rule is good until July of 2022, so this is not a permanent thing. IDPH could make it permanent, but currently it's only good through July of 2022. So I guess I can't tell you what you should or shouldn't do from a voting standpoint. That's your choice. But what I can say is what we've put together has been looked at myself. It's been looked at by our labor attorney, and it's our best effort to comply with the law.
Okay, thanks.
So on page 7, we mentioned that employees can take their mask off to eat and drink. I think if they're not vaccinated, they need to be 6 foot away from somebody else, because that's when it spreads, is when they're sitting there eating for 30 minutes and don't have a mask on. That's all I have to say. Thank you.
Okay,
Okay, did we have a second?
yes.
Duquesne.
Duquesne.
Oh, how do I need to back up then?
Need to back up?
Yeah,
Need to rescind your-
I need to rescind my motion.
I'll resend
to
my
approve.
second. Yeah.
Okay,
Okay, so, I recommend that, we amend this, for the circuit clerk. And, as Laura just stated, it will go back for those few amendments. I think that's it. Motion to,
motion to do it as amended.
as amended.
What are your amendments?
All those things Laura just listed.
I'm not saying you should do them all, I just was giving my feedback.
Well, I think I think it's good feedback.
To remove the circuit clerk.
We are going
Not
to
gonna
add
remove the circuit
language
clerk.
for the
The circuit clerk, you
circuit
just wanna
clerk.
follow the ninth judicial
Yes.
standard.
Because my issue is that if this stops, and the Supreme Court still says the circuit clerk's office has to wear a mask, then my employees are gonna be like, well, this ended, so I'm supposed to follow this. I just want something in there stating that they also need to follow the Supreme Court rules.
Yeah, that would
Well,
probably be
that's both.
better like that.
Also, we amended, we were gonna, take a
No
look at
positions,
the
no.
licensed, healthcare provider, and review that with Justin.
No physician's note.
No positions note. And what was the last thing, Laura?
Encourage them to get it to Fulton County Health Department to get their vaccine.
Yeah, encourage them to get a vaccine at the Fulton County Health Department. And the last one was, if you take your mask off for eating or drinking, you should be 6 feet away from someone else. Is that all of them?
Face covering, IDPH guidance, depending on the pets.
Oh, the face covering. Yeah. We will review the face covering section.
Okay,
Okay,
it's your call, boss.
all right. Thompson made a motion to pass it as amended. Second
Yeah.
by Duquesne.
Stacy has a question over here.
I just have a quick question. On page 7H, where it says an employee shall seek permission of his or her supervisor before working additional jobs. Couple of things. If they don't, what's the disciplinary action on that? Secondly, as a department head, I'm not comfortable telling one of my employees that they can't work something after 4 o'clock. I mean, their time and their commitment is to the county during the day, but if they have a second job at night, which I currently have one employee who does some evenings, obviously she's gonna be a responsible adult and exercise care, but I don't feel I'm in the position, or should I say, she can't. So, I guess,
Well, it says the county at its discretion, right? Wait a minute. No, I'm on the wrong. What page you on?
page
You're on
7,
Seven,
page
top.
7, Lisa,
Seven
at the top, in order to prevent the
Yeah.
spread.
Well, I'm just gonna tell you, that came from our original COVID policy. So that has been in
I
there
was thinking,
for a couple of years.
is, period, okay.
So,
I mean, it's fine if it stays, I just was,
I questioned it too, but I didn't add that to my list.
it was part of the original, that came in.
I have to work,
Let's
it'd
say-
be pretty hard for you to be able to tell somebody if they can't work someplace else.
Yeah.
How was that ever into the store?
They're just trying to keep it.
I think when COVID first started, and yeah, I think it was in there. Haven't had any
Roger.
pushback.
Sorry,
I just have a question or comment.
sure, go ahead.
Just speaking on behalf of the highway department, in order for us to comply with this policy, I'm gonna estimate needing 40 to 50 tests per month for 600 per year.
So
So
you've
just
got-
to let everyone know, I don't know where it's possible there's a place where this can come from, but that's my estimation. In order to comply with this, I would estimate I need 40 to 50 per month. And then I also have a question on what would happen if the Supreme Court changes this. I don't know the answer to those two questions, but I'm just speaking for my part.
You say you're gonna use 40 or 50 a month.
Test.
Is there a reason? I mean, you got a lot of employees that aren't vaccinated, or what do you,
In order to comply with this, that's about what I would estimate I would need. In order to comply with what is here. And I have one department.
Based on vaccination.
well, most of this is based on people that are unvaccinated, I
Right.
think. So you're facing that.
I'm saying to comply with that, what is written in there? I'm estimating needing 40 to 50 tests per month, or 500 to 600 a year, somewhere in that range. And I also don't know what the Supreme Court ruling, they haven't made a decision yet. So I don't know what impact, if any, that would have if they ruled on Thursday or Friday. I don't know if Justin can answer if the Illinois would supersede that or not. But regardless, there's gonna need some.
Illinois would definitely supersede that because the Supreme Court basically has not ruled. But they're dealing with the federal guideline, and the state has since passed a state rule. So, the question before the Supreme Court was whether they can do this to all the states. And if they say no, then it's up to each individual state to decide. And Illinois has already decided.
What happens if we can't get the test?
We're screwed.
I mean, seriously,
I know.
do we just go here and go on, or do we
Well-
say, well, you gotta go home because we can't test you?
Well, it's the same thing with the PPE. You know, we want everybody to have the proper PPE, and, you know, we're doing our best to make sure. that-
We'll have the test.
Good answer, I like that, Patrick.
I mean, we will.
Okay, so on the floor. Quick test at home.
All be wrapped.
All right. So,
Yes, there
is there anything else anybody's got questions about here?
Just one note that you mentioned the PCR test, and I don't know if it's listed in here, but in July, the FDA withdrew the emergency use authorization for the PCR test effective 12/31 of last year, so that isn't, an option for anything. Because they couldn't differentiate between influenza, AV, and COVID or coronavirus.
I'm sorry, Brian, I wasn't listening.
Just the PCR test is gone. There's no PCR test after December 31st. The FDA withdrew the emergency use authorization in July, effective 12/31.
So they're using that other test, that NAAT or whatever it's called?
Yeah, they just said they had to come up with something that could differentiate between influenza, A, B, and COVID and coronavirus.
Okay, so we're gonna be meeting once a week to revise this.
No.
We're doing our best to try to comply, and, we're just gonna have to play it by ear, kind of.
So as far as what is on the floor, your recommendation was, you made a motion to accept this with the amendments.
Right.
And the amendments we have is for Charlotte, or circuit clerk.
The amendments on the floor are to exclude the circuit clerk's office from this policy.
No, it's still
No.
on. It'll be that,
No.
that they will. They
They'll
gotta
follow
follow
the
the ninth judicial court.
Yes.
Well, then we're excluding them from this policy because they're not gonna follow the
Because
policy.
if they're not in the court,
They're gonna follow
yeah, but if they're.
the
if
Ninth
they're-
Circuit's policy.
Yeah, but if they're not in the court and in the courthouse, then they will follow the courthouse, what we have, right? Is
Yeah.
that what you're saying? The only time they have to follow the ninth judicial is when they're in the courtroom or in your office.
My only concern is at one point in time, the county had us wear masks, and then they said no. But the Supreme Court and the Ninth Circuit said yes, that my office still had it. So nobody else in this building was wearing a mask but my office.
Why?
Because if you were vaccinated, you didn't have to wear a
I'm
mask.
saying, why isn't everybody else wearing a mask?
The judges tell you to do something, you do it.
I understand that, but I'm saying, when she said nobody else in the courthouse had to wear a mask but them.
Because if you were vaccinated at one point in time, you didn't have to wear a mask.
Okay, but with this policy, that changes that.
Correct, but if this policy, so my employees signed this policy and then the Supreme Court still has that my office has to wear a mask, then my employees are gonna be like, I don't have to wear a mask. And then here I am, I'm going to be fighting because they signed something that doesn't say that not only do they have to follow Fulton County, but they have to follow the Supreme Court and the Ninth Circuit. Because I have to take orders from the judges.
I understand that, but there's nothing in here that says.
Okay, Justin, give us some clarification here, will you?
The policy isn't going to exclude the circuit clerk, but our policy is going to be that they follow the rules of the Ninth Judicial Circuit.
Thank you.
Okay, thanks.
Amendment to.
It kind of has the same end result, but they're still part of our policy. It's just that they're going to follow whatever the Ninth Judicial tells them to do.
Okay, we got that cleared up?
There's mud,
Clear as mud.
Mr. Chairman.
Okay,
Gonna take a roll call on this or not?
well,
As
if
soon
you
as
got
I-
anything else?
As soon as I'm directed.
Are we all done?
Stacy's got questions over here.
I'm sorry.
I can't see her over my computer thing.
I'm looking for what the discipline is, if it's not.
It says can be disciplined somewhere in there. Can be disciplined. And, you know, I would guess that, you know, that would be, you know, what the offense was. You know, if somebody with COVID walked up and French kissed one of their coworkers, I would think that they would probably be fighting.
Well, I mean, I think we got a whole lot of policies to cover. Any of that.
All right, settle down.
You threw me off. I can't even think now.
Sorry.
On page 6, you have failure to use PPE when instructed by the supervisor and readily available to an employee shall be grounds for discipline. And then on page 9, and if an employee does not provide documentation of a COVID-19 test result as required by this policy, they will be removed from the workplace until that test is provided. So that's the discipline. If they're not testing, they're not working.
Right.
Okay,
Yes.
okay, thank you.
Okay. Anybody else?
I'm not working without pay. Is that spelled out or?
All right, let's call the roll. Get through this.
All right. Are you sure? Barry,
Yes.
Bowler,
Yes.
Clark,
Yes.
Duchesne. Huh?
Yes.
Duquesne,
Yes.
Hope,
Yes.
Kessel,
Yes.
Coomer,
No.
Mattson,
Yes.
Meadus,
Yes.
Platt,
No.
Spangler,
Yes.
Thompson,
Yes.
Williams,
Yes.
Wilner,
Yes.
Arnett,
Yes.
and Beck.
Yes.
Motion carried, balls.
All right, we got through that one. Let's move on to the next one.
Oh, we have some more fun yet, folks.
Can you read this?
Okay.
Yeah, huh?
Are you
got-
gonna-
You got a resolution there?
Are you gonna read it?
Yeah, go ahead.
Whereas 55 ILCAS 5-5-1052 sets forth that the county board may do all acts and make all regulations which may be necessary or expedient for the promotion of health or the suppression of disease at times when 55 ILCS 5/5-25001 at sequence is enforced. And whereas 55 ILCS 5/5-25001 is enforced in Fulton County, and whereas it is the recommendation of the Personnel and Legislative Committee of the Fulton County Board that all members of the Fulton County Board adhere to and be bound by the coronavirus procedures and policy as amended and effective January 12, 2022 of Fulton County. It is further recommended that to facilitate the recommendation stated in the previous sentence, that all Fulton County Board members shall be considered employees as defined in the coronavirus procedures and policy as amended and effective January 12, 2022 of Fulton County, and any room in which the Fulton County Board meets to conduct a meeting pursuant to the Illinois Open Meetings Act be considered a workplace as defined in the coronavirus procedures and policy as amended and effective January 12, 2022 of Fulton County. Now therefore be it resolved by the County Board of Fulton County that all members of the Fulton County Board shall adhere to and are bound by the coronavirus procedures and policy as amended and effective January 12, 2022 of Fulton County. In order to facilitate the regulation stated in the previous sentence, all Fulton County Board members shall be considered employees as defined in the coronavirus procedures and policy as amended and effective January 12, 2022 of Fulton County, in any room in which the Fulton County Board meets to conduct a meeting pursuant to the Illinois Open Meetings Act shall be considered a workplace as defined in the coronavirus procedures and policy as amended and effective January 12, 2022 of Fulton County. A violation of this resolution shall be a petty offense.
Can I just add to that, that
I need a motion.
a motion to approve the resolution?
Okay, motion by Thompson, second by Arnett. Now you can talk about it.
Yeah, there was a question at committee, violation of this resolution shall be a petty offense. And, I believe that means that a board member could be fined from $75 to $1,000. Is that correct, Justin?
That's correct. That's the punishment set forth in that code section.
No. There you have it.
Is this something that you're telling us we have to do too?
It's
This
not
is-
something, hang on a minute. It's not something that we have to do. I kind of thought since if we was gonna have the court, well, the county doing it, that board members ought to adhere to it too. 'Cause, you know,
Lead
you're
by
gonna have-
example?
You're gonna have employees saying, well, board members don't have, why is this, why do we? That's my thought.
No, this is not a requirement whatsoever. I was asked to draft this so that it could be proposed.
Yep. So. It gets into a pretty gray area, you know, because in the ruling, it says if you report to work every 7 days, you have to be tested and stuff. We don't report to work here every 7 days. So,
But we do get paid.
yeah,
We do get paid, we gather for meetings.
so, you know. I just, Danny?
Just got a quick comment on this. Number one, I don't classify this board as employees. They are elected officials. Big difference there. So that wording, I'm not an attorney, but I'm not exactly sure that's the proper wording for that.
That's why this was written, was because the county board would normally not fall under that COVID policy. You're correct. We are not considered employees.
Right.
Therefore, we wrote a separate resolution requesting county board adherence to the policy to set a good example. If we gather for meetings, basically it means, what that means to the county board members is they also have to prove their vaccine status And if they're gonna attend meetings in person, they need a test 7 days before that meeting, within 7 days of that meeting. And if they're not vaccinated, they have to wear masks.
I would probably be the one that would come closest to falling into the category at all, because I'm usually at the office every day. Very seldom do I miss a day. So, you know, I don't have a problem with it, but, you know, it's up to you guys if you want to.
The other comment I had to go along with that, since she mentioned wearing a mask to the meeting, that's a mandate by the sheriff for the building anyway, so.
And it works good, right? I mean, if you're not vaccinated, you don't want to get a test to come to the meetings and stuff, we've got the call-in option. You can call in. Eliminates the whole problem. Okay, anybody got anything else? Let's call the roll, see what.
Bowler,
Yes.
Clark,
Yes.
Duchesne,
Yes.
Duquesne,
Yes.
Hoke,
Yes.
Kessel,
Yes.
Coomer,
No.
Mattson,
Yes.
Medis,
Yes.
Platt,
No.
Spangler,
Yes.
Thompson,
Yes.
Williams,
Yes.
Wilner,
Yes.
Arnett,
Yes.
Beck,
Yes.
Barry,
Yes.
motion carries.
Yeah, thank you. All right, moving on to finance, John.
All right. Okay, the first thing we have is an ordinance opting out the new provisions and low-income housing projects legislation. I'll move to, we adopt this ordinance.
I got her if you want.
Yeah.
Ordinance to opt out of preferential assessment for affordable rental housing construction and rehabilitation pursuant to Property Tax Code 35 ILCS 200/15-178. Whereas the Illinois General Assembly passed Public Act 102-0175, which amended the property tax code by providing for a preferential assessment for low-income housing, and whereas the reduction of taxable value for one property results in a corresponding increase in property taxes for all other taxpayers in a jurisdiction, and whereas the Fulton County Supervisor of Assessments has advised the Finance Committee and the County Board that the implementation of this program by the County of Fulton, Illinois, would require significant financial resources to administer. And whereas the preferential assessment is designed for property in Cook County, Illinois, but is applicable to all counties in Illinois. And whereas the property tax code provides that any county with less than 3 million inhabitants may decide not to implement one or both of the special assessment programs defined in subparagraph 1 of subsection C of this section and subparagraph 2 of subsection C of this section upon passage of an ordinance by a majority vote of the county board. And whereas the property tax code further provides that subsequent to a vote to opt out of this special assessment program, any county with less than 3 million inhabitants may decide to implement one or both of the special assessment programs defined in subparagraph 1 of subsection C of this section and subparagraph 2 of subsection C of this section upon passage of an ordinance by a majority vote of the county board. And whereas Fulton County, Illinois has less than 3 million inhabitants, and whereas the Finance Committee and the County Board finds it is in the best interest of the citizens of Fulton County, Illinois, to opt out of the special assessment programs and the provisions of 35 ILCS 200/15-178. Now therefore be it ordained by the County Board of the County of Fulton, Illinois, that the County of Fulton, Illinois does hereby opt out of the special assessment programs and the provisions of 35 ILCS 200/15-178. Be it further ordained that this ordinance shall be in full force and effect immediately upon its adoption. Be it further ordained that the clerk of the county board is hereby directed to prepare and deliver a certified copy of this ordinance upon its adoption to the Fulton County Supervisor of Assessments and the Fulton County Treasurer.
Okay, John, don't want to do that?
Sure, let's go for it.
I have a second. Second by Beck.
Basically, this law was wrote for Cook County. There's no need for us to do it. If you have any questions, our assessor will be glad to explain it.
There's a 3-page letter from me in your board packet that condenses 16 pages of legislation.
That's Spangler and who? Beck.
If you have any questions, I'm more than happy to answer them now or at a later time.
Anybody got any questions? Call the roll.
Okay, Clark,
Yes.
Duchesne,
Yes.
Duquesne,
Yes.
Oak,
Yes.
Kessel,
Yes.
Coomer,
Yes.
Madsen,
Yes.
Medis,
Yes.
Platt,
Yes.
Spangler,
Yes.
Thompson,
Yes.
Williams,
Yes.
Wilner,
Yes.
Arnett,
Yes.
Beck,
Yes.
Barry,
Yes.
and Bowler.
Yes.
Motion carried.
Thank you. Next.
All right, the next thing we have, and this will just be a discussion item, COVID bonus pay for employees. One of the things that ARPA money has been suggested to use for is to provide some bonus money for employees that have been working directly with COVID and those that have been put in looking at this. So we're having a special, the Finance Committee is having a meeting on the 25th just to discuss ARPA money. And so if you have any thoughts on this topic, just talk to the finance member, how you think it should be used. So that's all I got.
Okay. Thanks, John. Community development. Oh,
Nothing for board action.
oh,
Hold on.
Well,
Steve left.
Kessel,
Second. By Barry.
who?
Stan.
Sam. All right. Duchesne. Duquesne.
Yes.
Oak. Kessel. Coomer.
yes.
Madsen.
Yes.
Medis.
Yes.
Black.
Yes.
Spangler.
Yes.
Thompson.
Yes.
Williams.
Yes.
Wilner.
Yes.
Arnett.
Yes.
Beck.
Yes.
Barry.
Yes.
Bowler.
Yes.
And Mr. Chairman.
Yes.
You are
Thank
adjourned.
you, everybody.
Want that number to work, I go.
Oh, no.
No, it's sitting next to you. No, it's been that way all day. I don't have any symptoms other than a headache and a frog in my throat.